Alright, hi guys, I hope all of you are doing great and 2019 has been awesome for all of you. Today I want to talk about something called bipolar, and I have my very good friend Lishan who will be sharing with us about her experience and more about bipolar. And the reason why I'm doing this is because I feel that a lot of people have a stigma surrounding it or any form of disorders and diseases, and I would like to share more, and I feel like it's imperative for people to understand so that they be more compassionate to people who are suffering from it.
Yeah.
So, Lishan, you can share more about your experience.
Okay, so hi everyone, I'm Lishan. I'm a freelance yoga teacher and actress. So for me, when people look at me, they wouldn't assume that, wow, I have a mental health disorder. But actually, a lot of people amongst us have mental health issues. So actually, 1 in 20 people have bipolar disorder. Yeah, so that's the statistic. So can you imagine, every day when you walk past
there's
people,
quite a lot of
there's
people.
1 in 20 people who have who deal with mood swings, and it affects their work, it affects their relationships, it affects how they function in life. Yeah, so that's bipolar disorder. Bipolar means 2 poles, right? So you swing from mania to depression. Yeah, so that's what I suffer with, and alongside of that, a lot of people also have comorbid disorders, which means that they don't just have 1 disorder, they have 2 disorders. So I have bipolar disorder and bulimia nervosa, which I've had for 10 years. Yeah. So a lot of people, just throw the word bipolar around, like, like someone's being moody, right? Then you say, oh, you're so bipolar, or like someone's skinny, oh, you're anorexic. But it may not be true, because it actually hurts the people who are actually suffering from it. I would suggest that if you feel like you are suffering from certain mental health conditions, things like anxiety, depression, eating disorders, and more, you should really go to a psychiatrist, which is a medical doctor specializing in mental health and brain chemistry conditions.
But how do people realize that this is the right time for me to see a doctor? Is there any symptoms that would emerge and for them to know?
So for, let's say, if you're always depressed, right, you will feel a very low mood, you'll feel like you don't want to get out of bed, you no longer find enjoyment in things, and it really feels terrible inside you.
Right.
Yeah, so during my depressive phase, when I was about 18, I had a lot of suicidal thoughts, and I even attempted suicide twice during that period.
Okay.
Yeah, I was like cutting myself, I was binge eating a lot, needing a lot of sleep. Yeah, I wanted to withdraw socially from my friends, and I just didn't feel like there was a future to live for.
Sure.
Yeah, so it can be very debilitating.
So I believe you might agree that there are a lot of people out there that have assumptions or perceptions of bipolar disorder. They think that it is this, when actually it's not. So since you have gone through it and you're still going through it, what do you think are people's perspective and ideologies on bipolar and what it truly is?
So not just for bipolar disorder, even for mental health. A lot of people think that people with mental health, they are supposed to be locked up some way, or they behave in a very they're
violent
crazy
and wild.
Yeah, but it's not true, because for me, I attend group therapy, and all the people who come in, they all look very normal, and they're corporate people, they're from young to old, you can't tell. You just can't tell from looks, who has a mental illness.
Like, you cannot judge whether someone has a disorder or mental illness, or they don't, just by the way they behave or by the way they look, right?
Yeah, of course, because a lot of us, we are perfectionists. We tend to be able to hide the disorder very well from the world. Yeah, so it happens mentally inside the brain, because it's a neurochemical imbalance. You can't see it. Yeah.
So someone who is very cheerful and energetic can also be someone that actually have some form of disorders.
Yes,
they have to
of
recognize
course.
it, recognize the symptoms and seek help.
Correct, themselves, It's very difficult if, your family or your friends want to see it in you and want to seek help, but you are unwilling. It's quite a tough thing, So I think for a lot of people, they go into a very deep, vicious cycle or a dark period, or let's say the anxiety gives them like panic attacks and interferes with their work. That's when they finally, think that, maybe I should get some professional help. Yeah.
So for yourself, do you have any, tendency to do things that is irrational or impulsive, and then you regret later.
Yeah, correct. Because in bipolar disorder, the traditional name for it is manic depression. So besides the depressive side, which I talked about, the manic side, gives you a lot of high energy. It makes you not want to sleep. You can function very well with very little sleep. You hop from one job to another, and it seems like you have endless energy. But it really feels like you're in like a fast car that is going to crash anytime, but it's not crashing. It just feels like a roller coaster ride that never ends. Yeah, that's how it feels like, and it's very scary. It makes you do impulsive decisions. It makes you make a lot of decisions that are not aligned to your true values. Like you will say yes to things that you wouldn't normally do, or you will go on spending sprees, because you have so much energy and so much mental excess, that you want to put out.
So it's like
you
a
become
spiral,
talkative.
right?
Yeah.
So you can have like your highs, and then you can have like your ultimate lows, and it just keeps going up and down.
Sometimes it's called a mixed state as well, where you can feel both high and low at the same time.
Sure.
Yeah.
So what did you do that helped your condition?
So for me, because it's a genetic brain-based condition, you need medications to control it. Psychiatric medications like atypical antipsychotics, or some people use lithium or anti-epilepsy drugs to control bipolar. Yeah, so I'm currently cycling through different trials.
Okay.
I've been on 4 medications, and hopefully this one works, because each one has different side effects. Yeah, so it might not be suitable for you. So currently I'm trying my 4th one. Yeah, so hopefully it works for me this time. And DNA testing as well, it can actually help to
DNA test.
help to eliminate those drugs that maybe you're allergic to or won't work for you, and to find like a better dose for it.
So has seeking help with a doctor and therapist help you feel better mentally and emotionally?
Yeah,
Like you're able to
definitely.
cope, like when you have your symptoms emerging or something triggers you,
Correct.
based on what you have learned, besides the medication.
Yeah. Because in therapy, you
yeah.
learn things like emotional regulation. You get to speak about and work on yourself, with a therapist who's trained in understanding your disorder and the ups and downs that come with it. Yeah, so I
Okay.
would say talking about it with a trained professional really helps.
So it's important to actually vocalize
Yes.
your difficulties and what you're going through, and actually seek help, rather than to think that you can actually help yourself for a very long time.
Correct.
And actually go through more pain.
Yes, exactly
and
that.
start hurting yourself more.
For me, it took a long time before I finally saw a psychiatrist. Just about in September last year, so just about quite a few months ago only. Yeah,
Okay.
I've already been having bipolar symptoms since I was a young child. Like, like I would be very hyperactive at parties, and then after that I would like crash and like feel very angry or feel very moody. My friends saw that in me, but
But you did not.
yeah, but I didn't know it was a disorder. Obviously, I'm a young child, and for families as well, like parents can be quite blur, or they just see it as maybe a phase in your teenage life. Yeah.
So it's almost like a denial, right? Like you do not want to accept that you're having this disorder because you feel that. I mean, is that how you felt? And you think.
For me, I was ignorant. I didn't know I have it. I had the disorder. Yeah.
So people might actually not know at all.
Correct.
that
So
they have such.
so it's quite sad that some people go through life, thinking that they're abnormal, or people think that they are weird or crazy, but actually, they're actually suffering from a brain-based illness.
Makes sense.
But of course, there are ways to cope. Like having things that you can control, like having good sleep hygiene, having a nutritious diet, having regular exercise. Yeah.
Sure. Do you think a healthy lifestyle actually makes you feel better?
Of course. Having enough sleep is very important, because if you havoc with your sleep patterns, yeah, correct.
And sleep cycle, like a fixed sleep cycle, is gonna help you as well, right?
Yeah.
Because people tend to think that sleep is just like a small thing, like you just have to sleep and wake up. You can sleep like at midnight today and wake up earlier tomorrow, and then like it keeps changing, but actually it affects.
Yeah, or even
yours.
thinking that it's okay, I can sleep 2 hours today, then I'll make up for it. But it doesn't work that way. Yeah, you need to establish like a healthy routine.
Alright, so here are 10 things that you can do to help someone that has a bipolar disorder or any form of mental illness, diseases, and whatever situations they are going through. The first one is...
So these are all curated by Ezzy.
Yeah, so the first one is you have to listen to them, and you want to listen to them attentively. Do not hear, because there's a difference between hearing and listening. Let them speak and listen to them with an open heart and an open mind. And 2.
Yeah, so secondly would be to show empathy and kindness. A lot of us don't understand, right, what people are going through. So by maybe reading up more and understanding, you show kindness to them and it helps them to open up.
And 3, find out what exact symptoms they're going through and what is the diagnosed disease and disorder that they have. Because when your loved one or your friend or anyone that you know is going through something as serious as this, you will be more compassionate and understanding to what they're going through, and you will be able to deal with the way you react towards them.
Yeah. Okay, so point 4 would be to advocate for them to see a doctor, like a psychiatrist, and also a therapist, because they would be the ones who are able to prescribe them the right medications and get the right diagnosis so that you can move forward, with the treatment.
5, encourage them to get out of their house as much as possible, because when they're alone or they're cooped up by themselves, they tend to have a lot of negative thoughts. It's like dark clouds and it's just not healthy. So bring them out for a walk, movie, to bring them to an art gallery, go on an adventure, spend some time with them.
Yeah, so 6 would be to spend quality time, like he said. Yeah, so quality over quantity, right? What you do in that short 1 to 2 hours is important. Yeah, like have good conversations, help them to get out of their head, talk to them about their concerns,
find out more about what they're going through. 7, respect their desire to tell and not to tell certain people about their illnesses, because sometimes when they go through this, they do not want to tell certain people about that. So do not be asking like why you can tell this person but you cannot tell the other person. Just respect their desire and their decision and listen to them.
Yeah. So 8 would be to be patient with them and give them space whenever they need it, because sometimes you want to be alone with yourself, you want to have time to think about your diagnosis, or just to spend time with yourself and reflect and contemplate. So just give them that space when they want to.
Yeah. And 9, do not assume what they want and what they do not want, because as human beings we tend to assume a lot just by the way someone behave or the way someone speak.
Okay, so point 10 would be to take care of yourself so that you can be the best to take care of other people. Yeah, because there's this thing called caregiver fatigue, and if you're constantly giving yourself and putting too much into someone else, you don't take care of you have to put your own oxygen mask on. Yeah.
So you must be at your best, so that when you're at your best, you're healthy and you have enough rest, so you can help your loved one, family, friend, or anyone that you know that has a disorder or they need help.
Yeah.
Alright guys, this is the end. I hope all of you got some really good value from this video. And if you're someone out there that has a disease, or you feel like you have some symptoms and you do not know what to do, who to talk to, you're scared, you have fear, and if you feel that you can talk to your friend, go ahead and do it. Do not hesitate, take the right action, and feel free to also drop a message or a DM to Lishan and to me. Her link is below here, so hit us up if there's anything you'd like to share, or if you'd like to be in our video next time.
Let us know.
Do share with us. Yeah, we'll be happy to have you. Alright, have a great day and enjoy your time. Bye bye.